Now I am going to bring up Dr. Joseph Q. Jarvis. Dr. Jarvis received his medical and public health training at the University of Utah School of Medicine. His career includes time as a family doctor at a community health center, the state health officer for Nevada, a public health physician for state and federal agencies, a physician consultant with a national practice, and a specialist in occupational lung disease at a tertiary care center. Dr. Jarvis has seen American healthcare across the entire spectrum of care. He is also chair of Common Sense Healthcare for Utah, the organization that will put single payer on the ballot in Utah in 2026. Woo! I was told I have to mention that you also have a book that you wrote, The Purple World, Healing the Harm in American Healthcare, and Dr. Jarvis joins Scott as a member of the documentary Healing Us US. Doctor, welcome. It's very wonderful to have you.
Thank you. It's an honor to be invited to speak in Minnesota and to be on the same program with Kip and Lana and Scott. People who I admire and who have affected how I approach health policy. I'm a Medicare beneficiary myself, as is my wife. And between the two of us, we've had ample experience, unfortunately, with seeking health care using traditional Medicare with a supplemental plan to know what a remarkable and useful program Medicare still can be. However, I haven't been invited to speak to you because I know from firsthand experience how efficient and practical public financing for healthcare is. Rather, I've been asked to speak because I have a political perspective which is uncommon among single-payer activists. I am what I refer to as an original conservative, by which I mean I grew up in the tradition of conservatism which was birthed by Abraham Lincoln and Ulysses Grant, reshaped by Teddy Roosevelt, and last represented in the presidency of the United States by Dwight D. Eisenhower. I was born and raised in Arizona back when Senator Barry Goldwater was the dominant political figure there, and I learned my conservatism from him through my mother. I distinguish original conservatism from that brand of politics now routinely associated with the Republican Party, which in my opinion isn't conservative at all. I'm not here to educate you about who is and who is not conservative, but I make the distinction between original conservatism and that practice today in order to point out that original conservatives honored and revered the necessity of government intervention in the lives of constituents. Lincoln used the federal government to preserve the Union and to emancipate the enslaved. Grant created a new branch of the federal government, the Department of Justice, in his efforts to find a just way of life for newly freed African Americans. Teddy Roosevelt, who was both an original conservative and the original American progressive, used the power of the federal government to give the average working man and woman a square deal, meaning a chance to use his or her labor to make a life for a family. Eisenhower made interstate automobile travel more rapid and efficient and available to all. They all believe that government is an honored institution with a mandate to serve the people. Goldwater did likewise, but clarified that conservatives are apt to argue about which functions of government should be reserved for the states and which were better done by the federal government. I'm still persuaded by Goldwater's 10th Amendment ideas. Today's so-called conservatives do not honor the role of government in our lives. Beginning with President Reagan, it has become common among these reactionaries to denigrate government, to run for office proposing to throttle it or to eliminate it entirely, and to justify all that by saying government is not the solution to problems because government is the problem. These present-day government nihilists are not conservative. They are merely market ideologues, mistaking not only the role that government should play, but what the legitimate role of market forces might be. I don't believe these pseudo-conservatives make up a majority of those Americans who align themselves on the moderate or further right side of the political spectrum, but they do take up a great deal of the oxygen in that part of the room. Why talk about conservatism at all in the setting of a celebration of the creation of Medicare? Well, for the obvious reason that if we are to defend Medicare, improve it, and extend its benefits to all Americans, we must persuade and enlist more than those Americans who already favor Medicare for all, who by and large are on the progressive side of the political spectrum. So how does one persuade moderates and conservatives to think broadly about single payer and ultimately embrace it as a conservative policy, and to act to influence the body politic to change how we do healthcare business? Before I answer that question, let me advise any of you who seek ultimately to speak with such audiences, that is from the right side of the political spectrum, about single payer, that the ideologues who are out there are not persuadable. Rather, they have a permanently skewed perspective and only seek to confirm their own biases about how terrible government is. Don't waste your time and your effort positing the ideas I'm about to describe to someone who is permanently and intentionally blinded by nonsense. Spend your time with those who can make sense out of the facts concerning single-payer health system reform. I promise you there are many of those people, myself being one of them. So here are the three main points that I make repeatedly to my conservative and moderate friends, family, and neighbors in Utah and elsewhere. Number one, single-payer health care is constitutional. Number two, single-payer health care is the most fiscally conservative method to finance health care. Number three, single-payer health care is morally and ethically conservative. Let's begin with what I mean by single-payer being constitutional. This is actually a very common sticking point for conservatives. Most of my friends and neighbors in Utah have heard the oft-repeated single-payer advocacy catchphrase, healthcare is a human right. I've been part of the single-payer movement for more than 30 years, and I've grown accustomed to the phrase. And I believe I know its origins and what is meant by it. I agree that every human being should receive all medical care that is necessary. But conservatives who are not ingrained into the single-payer movement will tend to react to that phrase, as did Surgeon General C. Everett Koop, who I heard once state, while he was in Utah, by the way, that no one has a right to health care because that right is not articulated in our Constitution or its amendments. Conservative people who resist the notion that people have a right to the care that they need are, at least in some respect, implying that single-payer health care is not constitutional and therefore they will oppose it. When I meet this kind of resistance, which unfortunately is not uncommon, I respond by stating that there is no constitutional right to asphalt either. Yet beginning with President Eisenhower, governments at all levels in the U.S. have used eminent domain and taxing authority to apply asphalt to public roadways such that I can now drive from my house to the White House without paying a toll. We do this, of course, because roadways are infrastructure needed for families in the 21st century. Our economy thrives and provides opportunities for all of us to pursue life, liberty, and happiness, and I would use those terms with conservatives, in part because we Americans have recognized the need for roadway infrastructure, and we have met that need, even if no right to asphalt is overtly stated in the Constitution. I complete the analogy by pointing out that like roadways, healthcare systems are infrastructure that 21st century families need to pursue a fullness of life and freedom, and it is eminently within the reach of government established to promote the general welfare to use its authority to publicly fund health care. I elaborate further that single-payer advocates are not inventing a proposal to publicly fund health care. Rather, Americans have generously funded health care through tax policy at federal, state, and local levels for 75 years. We Americans tax ourselves more for health care than do the citizens of any other nation on a per capita basis. Programs like Medicare, which have existed for more than a half century, are clearly constitutional because they have stood the test of time. Medicare for all, therefore, would also be constitutional. If, however, the single-payer movement were to break through with an enactment of a single-payer program in one or more of the states, by ballot initiative or legislation, that too would be constitutional, given that the 10th Amendment of the Constitution allows, quote, the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states, end quote. Single-payer health system reform is constitutional. That's how you start your argument with conservatives. Point number 2, conservatives care about reducing the cost of government to its minimum. So I consistently make the point that single-payer health system financing is the most fiscally sound method of paying for health care that we all need. Most advocates for single-payer health system reform, like you here in this room, understand the basics of the economic advantages of single-payer, so I'm not going to belabor the practicalities of that point, but instead I'm going to read you selected passages from the narrative of the economic analysis for our single-payer proposal in Utah, which was authored by Dr. Gerald Friedman of the University of Massachusetts. We asked him to particularly highlight points that we thought would be important in our more conservative state. So I think you'll find some of this helpful in clarifying what will resonate with that audience. Just by way of clarification, we in Utah have named the proposed single payer in our state, Utah Cares. So here's a quote, an extended quote from the report. Utah Cares will finance medical care with substantial savings compared with the existing multi-payer system of public and private insurers. By reducing administrative and other waste, including health insurance company profits and excessive prices for drugs and medical devices, and a form of global budgeting for hospitals, the plan would increase real disposable income for the vast majority of Utah residents. It would simultaneously increase employment by reducing the burden of health insurance on businesses. Some of these savings would be used to extend coverage to the 3% of residents still without insurance under the Affordable Care Act. Other savings would be reinvested in the healthcare system to improve coverage for the growing number with inadequate coverage. We spend more on healthcare in the United States because the price of care is higher in the United States. No other country has performed so badly and developed so much waste in its healthcare finance system. By reducing access to needed care, rising deductibles and copays have increased mortality. With fewer people covered and soaring deductibles and other forms of cost sharing, the cost of being sick and the cost of receiving health care has increased. Facing higher costs, we see in Utah the same pattern seen in the rest of the United States, increasing mortality where the sick cannot afford access to health care. Simplifying the reimbursement process would save physicians nearly 6 hours a week, equivalent to more than a 10% increase in the available supply of physicians. If Utah healthcare providers, including hospitals, nurses, physicians, were to spend only as much on administration as do providers in Canada, they would save nearly $9 billion annually on administrative costs. In the current system, nearly 10% of total spending goes to the administration of the insurance system, including private insurance and employer-sponsored self-insured plans. And this does not include the vast cost of administration borne by the general public. Private insurers spend over 20% of premiums on administrative activities, including redundant bill reviews, medical review programs, and other overhead plus profit. Private insurers also waste resources in other ways. Competition leads them to spend money on advertising and marketing their competing plans. That's spending that cures no illness and provides no health care. Raising the medical loss ratio to the level of traditional Medicare, 98%, would save Utah over $3 billion in 2027. Eliminating the need to identify and administer private insurance plan would save employers another $300 million. Lowering hospital prices to Medicare rates plus 10% would save over $1 billion in 2027 while providing more funding for smaller and safety net hospitals. The International Federation of Health Plans found that for 8 common drugs, the price in the United States is on average 3 times the average price in Canada, England, or the Netherlands. Negotiating directly to buy drugs in bulk, the Veterans Administration provides drugs at half the price paid by other Americans. With a population of over 3 million, Utah is as large as some small European countries, which have much lower drug prices. A single agency negotiating prices for 4 million residents should be able to negotiate dramatically lower prices, which would save nearly $1 billion in 2027. End of quote. In summary, Dr. Friedman projects that Utah Cares will bend the healthcare cost curve in Utah, dropping the proportion of state domestic product spent on healthcare from 17% to 15% in the first year of implementation, with a further drop to 12% after a decade of operation. No similar shrinking of healthcare costs can be projected for business as usual in Utah healthcare. Simply stated, there is no better pathway to healthcare fiscal responsibility than single-payer health system reform. There will be objections to single-payer in a conservative audience because it is understood by them, or by some of them, to be socialism, which some will say is bad policy in and of itself, and allegedly fails to avail itself of the salient effects of the invisible hand of the market. I take a direct approach to the complaint about single-payer being socialism. Socialized medicine is a successful model in the United Kingdom and elsewhere, and is characterized by the government owning hospitals and employing health professionals. American single-payer advocates, including those of us in Utah, do not propose any such thing. Single-payer healthcare reform creates a system characterized by public financing for private healthcare delivery. Americans have been publicly financing healthcare for at least 75 years. Single-payer advocates do not propose to change that. Americans apparently prefer private healthcare delivery, which is how healthcare in the U.S. is currently organized. Single-payer advocates do not propose to change that either. Therefore, single-payer health system reform is not a variation of socialized medicine. Yeah. As to the wonders of market forces in healthcare, the answer to that contention takes us to our final point. Single-payer healthcare is morally and ethically conservative. So-called market-oriented healthcare is not morally correct and therefore not conservative. The healing of the sick is a sacred subject. All belief systems I am aware of encourage people to care for all those who are sick and injured. My understanding of the sacred nature of healing comes from the practices for blessing the sick in my own religion, the Church of Jesus Christ of Latter-day Saints, and in other Christian churches, such as the Roman Catholic Church. In both the Roman Catholic Church and my church, the sick can be anointed with consecrated olive oil as a way to call down the blessings of God upon them. As a lay minister in my church, I have many times been asked to offer this blessing, and I'm comforted to know that in other churches a similar blessing can be arranged. That God cares for the sick is evident from the text of the Bible. Healing of the sick was practiced by the ancient prophets Elijah and Elisha. The Lord himself healed King Hezekiah. Ezekiel found that the failure to care for the sick was a direct cause of the demise of the kingdom of Judah. He said, speaking to the governing elites of Judah, who had so obviously failed in their stewardship, quote, you shepherds of Israel, who have been feeding yourselves. Should not shepherds feed the sheep? You eat the fat, you clothe yourselves with the wool, you slaughter the fatlings, but you do not feed the sheep. You have not strengthened the weak, you have not healed the sick, you have not bound up the injured, but with force and harshness you have ruled them, end quote. Jeremiah too warned about the societal effects of abandoning the sick. During his 40-year ministry leading up to the destruction of Jerusalem by the Babylonians, he preached about the deceit and dishonesty of ignoring illness and injury. Quote, for the hurt of my poor people, I am hurt. I mourn, and dismay has taken hold of me. Is there no balm in Gilead? Is there no physician there? Why then has the health of my poor people not been restored? End quote. Care of the sick and the injured was the signature gift of the man known as Jesus of Nazareth. For instance, in the book of Matthew, we find these verses. Then Jesus went about all the cities and villages, teaching in their synagogues and proclaiming the good news of the kingdom and curing every disease and every sickness. Matthew chapter 9. Great crowds came to him, bringing with them the lame, the maimed, the blind, the mute, and many others. They put them at his feet, and he cured them. Matthew chapter 15. Then the king will say to those at his right hand, "Come, you that are blessed by my Father, and inherit the kingdom prepared for you from the foundation of the world. For I was sick, and you took care of me." Then the righteous will answer him, "Lord, when was it that we saw you sick and visited you?" And the king will answer them, "Truly, I tell you, just as you did it to one of the least of these who are members of my family, you did it to me." End quote. Matthew chapter 25. That the business practices of healthcare can disrupt the sacred responsibility we all have to the sick and injured is illustrated by the contrast between a 16th century physician and his stepson. Dr. John Syminges was one of London's most successful physicians in the late 16th century. His mantra for his medical practice was simple, quote, "Before you meddle with a patient, make your bargain wisely, now he is in pain," end quote. Quite simply, he urged fledgling doctors to settle the fee for treatment while the patient was unable to negotiate. Dr. Syminges would be entirely forgotten to us now, and deservedly so, but for the accident of history that by marriage he became the stepfather of John Donne, one of England's greatest poets. Once, while too ill to arise from dead, Donne, then the dean of St. Paul's Cathedral, heard the church bell tolling and wrote his 17th meditation, from which I'll quote, "Perchance he for whom this bell tolls may be so ill as that he knows not it tolls for him. And perchance I may think myself so much better than I am, as that they who are about me and see my state may have caused it to toll for me, and I know not that. The bell doth toll for him that think it doth. No man is an island entire of itself. Every man is a piece of the continent, a part of the main. If a clod be washed away by the sea, Europe is the less, as well as if a promontory were, as well as if a manor of thy friends or thine own were. Any man's death diminishes me, because I am involved in mankind, and therefore never send to know for whom the bell tolls. It tolls for thee. Another man may be sick too, and sick to death, and this affliction may lie in his bowels as gold in a mine, and be of no use to him. But this bell that tells me of his affliction digs out and applies that gold to me, if by this consideration of another's danger I take mine own into contemplation." End quote. For Donne, illness in another, no matter how remote our contact, is to be shared, contemplated, and learned from. Wealth generated from the sick comes not as coin, but as shared human experience for which the observer may be grateful. Donne would have each of us contemplate our personal danger as we make ourselves aware of the afflictions of others. These lessons of 300 years ago need relearning now. Medicine, once again, has been reduced to a business opportunity. In a nation where tens of millions have no financing for basic healthcare services, leading to tens of thousands of preventable deaths annually, our body politic has become paralyzed by a market-oriented health policy. Bells are tolling, yet we pretend we are not diminished by the suffering of our fellow countrymen. We pretend that the afflictions of the uninsured are not ours to share, as if we individually are an island entire of itself. This despite the fact that we pay twice as much per capita for health care than do the citizens of the rest of the developed world, mostly in the form of the highest per-person taxes for health care in the world. What we are missing is the contemplation of our own danger. Americans are least likely in the developed world to avoid death preventable by clinically appropriate health care. We have allowed the business of medicine to so deviate our health system from its principal mission that preventable injury to hospitalized patients has become the third leading cause of death in our country. More than 20 years ago, Tony Snow, who died from colon cancer while serving the Bush White House as press secretary, made this statement, quote, "In the real world, people stampede when somebody slaps up a sign that reads free." That is the theory behind bargain basements, but it also applies to hip replacements and appendectomies, end quote. This is the Dr. Syminges approach to medicine, reiterated in modern parlance. And it makes no more sense now than it did then. I have never met a patient willing to have his appendix removed because a hospital had bargain basement appendectomies on sale. Is medicine a commodity, efficiently distributed and traded by markets? Are patients shoppers or customers, or are they the people for whom the bell tolls? I doubt Mr. Snow actually behaved in the way he identifies when he was a patient. As far as I know, he didn't attempt to start his course of chemotherapy before he had cancer because he found the drugs on sale. After colon cancer, would he still maintain that Dr. Seminji's approach to making the bargain with the patient while he's yet in pain is the correct one? I really don't think so. The Wall Street Journal, an authority on markets and customers, may help us with an answer. A few years ago, an opinion piece in the journal included this thought, and again, it's a quote. Research at Dartmouth Medical School suggests that if everyone in America went to the Mayo Clinic, our annual health care bill would be 25% lower. That's $500 billion less. And the average quality of care would improve. Of course, not everyone can get treatment at Mayo. But why are these examples of efficient, high-quality care not being replicated all across the country? The answer is that high-quality, low-cost care is not financially rewarding. Indeed, the opposite is true. Hospitals and doctors can make more money providing inefficient, mediocre care, end quote. Now, if that statement, that hospitals and doctors are paid to deliver inefficient, mediocre care, if that's confusing to you, let me illustrate that with data from a hospital in central Utah. In the mid-1990s, a family physician practicing at San Pete Community Hospital observed that patients presenting for treatment of pneumonia were not receiving optimal care, and therefore they were becoming sicker and dying more often than they should. He organized a protocol for optimal treatment of a community-acquired pneumonia. He persuaded every one of his physician colleagues at the hospital to follow it, and he induced the hospital to adopt it. Almost overnight, the care of pneumonia improved. 25% fewer patients became sick enough to require hospitalization. For those patients admitted to the hospital, the length of stay dropped by 1/3. The length of time before the instigation of proper antibiotic dropped by 1/4. And the cost per case fell by 1/2. This is the optimal outcome in a market. The quality of service goes up and the cost drops by half. In a functioning free market, the provider of such a service would be handsomely rewarded. Unfortunately for San Pete Community Hospital, there was no reward. In fact, the amount paid for pneumonia care fell even more than the per case cost fell, which means the hospital took a financial hit for doing the right thing for pneumonia patients. Hospitals and doctors get the best payments when they let their patients get as sick as possible. The hospital got paid a lot more if a patient got sick enough to go to the ICU. That's really what it amounts to. The business model of the medical industrial complex, because of the for-profit motive, is more about making sales than actually caring for patients. This is what the Wall Street Journal meant when it said there are perverse incentives in the American healthcare system. The fact that American healthcare pays doctors to harm patients through mediocre care is evidence that market principles cannot work in healthcare. A market does not have perverse incentives, and a market commodity does not have a lower price for higher quality. Healthcare is not a commodity. Dr. Seminji's was wrong. The best bargains are not driven by the patient's pain. If you want further evidence that healthcare is not a market commodity, consider this. Around $3 trillion of our nation's more than $4 trillion in annual health expenditures comes from our taxes. What market is 2/3 tax funded? Why do we taxpayers agree to fund healthcare so generously? Because in our hearts and minds we know that John Donne is right. Any man's death diminishes me. It matters to all of us whether the uninsured tuberculosis patient receives appropriate care. His illness places society at risk. In healthcare, we do not believe in caveat emptor because the buyer is a patient, neither prepared for nor able to shop. We place ethical obligations on physicians to serve their patients' needs ahead of their personal interests. John Donne was right. When it comes to health care, Americans have always known that no man is an island. Single-payer health financing is morally correct and therefore conservative. Market principles do not efficiently distribute or finance the care needed by injured or ill patients. Market-based healthcare is morally wrong. In summary, single-payer health financing is constitutional. For 75 years, we Americans have principally financed healthcare with public dollars. It is well within the constitutional powers of both state and federal governments to use those public funds exclusively for first-dollar financing of all medically necessary care. Doing so, as opposed to business as usual in American medicine, would make our healthcare system far more fiscally responsible. Single-payer health system reform creates the conditions that allow us to deliver better care, more simply financed, to every patient in need, while downsizing the percent of the gross domestic product devoted to our healthcare system. Therefore, single-payer health financing is the most fiscally conservative way to do healthcare business. And finally, single-payer health financing is morally correct. For me and other Christians, it is an answer to the call of Jesus of Nazareth to visit the sick and injured brothers and sisters, even the least of them. It fulfills the mandate of the ancient Jewish prophets for the governing elites to look to the care of all members of society or face the consequences of a weakening society. In fact, all belief systems, as far as I know, from humanism to monotheism, require the devout to practice care of fellow humans. Single-payer health financing concentrates our social interest on the sick and injured and is therefore morally conservative. We in Utah are trying to do something about the bad practices of business as usual in American healthcare. We have organized a 501c4 organization, Common Sense Healthcare for Utah, and are planning to place single-payer health system reform on the ballot in 2026. I have displayed this slide throughout my presentation so you could make note of the website, which is at the bottom, commonsensehealthcareutah.org. I hope you'll link to it and learn more about us. Or you can use the QR code that's over on the far side there. I recently spoke in Colorado, where I learned that a single-payer ballot initiative was defeated in 2016. Advocates for single-payer there raised $800,000 for the ballot initiative campaign, but they were outspent 10-1 by the opposition, which spent $8 million and defeated the measure. So we in Utah are asking for the help of all single-payer advocates across the country. We don't want to be the only target in 2026. Either donate to our cause directly and help us raise as much as possible to bring our campaign to a successful conclusion, or even better, place your own single-payer bill before the electorate or the legislature in 2026. Force the opposition to single-payer to fight on more fronts. Dilute their resources. I hope I've helped you. Thanks. I hope I've helped you understand how to better advocate for single-payer among conservatives. You can learn more about this in either of my two books about health reform, the one that was mentioned, The Purple World, Healing the Harm in American Healthcare, or my more recent book, which is called For the Hurt of My People, Original Conservatism and Better, Simpler Healthcare. Thank you very much.